As of today, there are now more than 7,500 Albertans who have recovered from COVID-19. On June 30th, we identified 30 new cases from over 6,900 tests. Yesterday, from approximately 7,600 tests, there were 64 new cases identified. Currently, there are 44 people hospitalized, with 8 of those in intensive care. Sadly, I must report one new death over the past 2 days. My heart goes out to all who are mourning the loss of a loved one. Whether through personal loss or other circumstances, I am deeply aware that this can be a difficult time for many in our communities. It can be especially difficult for Albertans living with disabilities. People who have neurologic conditions and severe physical disabilities depend on caregivers for a broad range of living functions. My colleagues at Alberta Health Services have developed a number of resources to support those living with severe disabilities and their care providers during this pandemic. This includes a toll-free rehabilitation advice phone line, which provides information on activities and exercises to support physical functioning and strategies to manage daily activities. It also provides links to in-person or virtual rehabilitation services and to community resources that can provide supports. Anyone who may need these services can find more information on how to access them on the Alberta Health Services website. We are also working on outreach to hear more from representatives of those living with disabilities. I want to mention that I know many Albertans are thinking about hockey right now and wondering how the NHL's hub event might be held in Edmonton without jeopardizing public safety. I do not have any news on whether Edmonton has been officially chosen by the NHL, but if it is, I want to assure everyone that safety remains our top priority. This spring, we developed guidelines for professional sporting tournaments to support safety for players, NHL staff, and media, and to minimize any risk of virus spreading to the general public. While there are many components, the approach relies on extensive privately purchased testing, and the NHL players and anyone else involved in the tournament forming a cohort that is separate from the public. Cohorting among the participants will reduce the risks of disease spread if a case is identified. If Edmonton is chosen for the NHL's event, health officials will work with all applicable partners to ensure the guidance is followed to protect the public and those involved in the tournament. We will also ensure that public testing is in no way impacted if the NHL does pick Edmonton. The free testing being offered to all Albertans will always remain our top priority. If there were any activity, whether it was NHL play or any activity that was causing significant extra risk to the public, if the guidelines that we have put out for various settings, so we again have the guidance document for professional sporting events that we've put forward to the NHL that has been accepted. We also have guidance for many other events, and so if, whether it's the NHL or any other event, were to forego those pieces of precautions that are laid out in the guidance, if again, whether it's the NHL or anyone else, were to say, we don't accept these anymore, we're not going to follow these, and there were to be transmission as a result, certainly if the guidance was not being followed, that would indicate a need to have further conversation, and if after that conversation there was still a lack of interest in following the guidance, then that would be the point, again, whether it's the NHL or anything else, that point at which more stringent sanctions would need to be put into place. Again, through any of the conversations that I've had to date, there's not been any indication that there's been concern with the requirements that we had put out with respect to protecting public health. But again, just like any other event, any other organizer, if guidance is not being followed, if it's being disregarded, and if the public's health is being put at risk, then we would follow the same steps that we would take with any other organizer in terms of that same kind of ladder of follow-up with conversations, education, and if needed, then measures to ensure that compliance was in place.